from Diane. Again, a question that I get for every patient that I talk about surgery with is, what is the life expectancy of a total joint replacement? So both hip and knee. Really, I break this up into two separate categories. So younger patients and older patients, okay? They do have a little bit of a difference in their longevity overall, and that's generally because younger patients are a little bit harder on the replacements. They really get back to their lives, and their lives are a little bit more stressful, strenuous. They're more active during the day. So I tell people who are, for knee replacements, people who are under the age of 60 to 65, they can really expect their total knee to last anywhere from 10 to 15 years. And then patients over the age of 65, I tell people that I'm shooting for about 15 to 20 years after that type of joint replacement. That doesn't mean that everybody needs a new or a revision joint replacement in that time period. However, it becomes more and more likely that you'll require a revision surgery or follow-up surgery after that. Now, hip replacements, again, under the age of 65, I'm telling people about a little less than 20 years to expect. And then over the age of 65, my hope is that we're in the neighborhood of 25 to 30 years for those joint replacements. Now, what are the things that change how long those joint replacements last, though? So one of the things we said was age, obviously, and then the activity level that often goes along with age, but also a patient's weight. So again, under a BMI of 40, like we discussed earlier, often have an increased longevity of those joint replacements, especially with knees that use a cementation technique. It improves your longevity. The other things are, sorry about that. The other things are related to some medical comorbidities that can creep into the picture. And then in addition to that, over the last, if we were doing this presentation 10 years ago, the style of the prostheses, the make of the prostheses, and how well the implant companies are doing with maintaining the longevity of the implants has changed quite a bit. So in the future, I'm hoping to tell patients, an additional 5 years, but at this point, that's what we've got.